following segment is sponsored by Baptist Health.
Well, unfortunately, strokes can happen to anyone at any age. May is Stroke Awareness Month, and Baptist Health is here to help us understand a little bit more. Sarah Launius is with Baptist Health Medical Center in North Little Rock, and Whitney Raheem is with Baptist Health in Conway. Both are RNs and both are stroke coordinators, and we're glad to have both of you here. Thanks for coming in.
Thanks for having us.
Sarah, let's talk a little bit about what we mean when we have a stroke. What happens to our body when we have a stroke?
Well, stroke is really it's a true brain emergency, okay? We lose 32,000 neurons or brain cells every single second that we're having a stroke. So there's two different types of strokes. The most common, happening 85% of the time, is an ischemic stroke.
Okay.
What that means is that there is a block of blood flow to the rest of the brain, okay? So that usually is caused by a blood clot in the brain. And the other 15% of the time is called a hemorrhagic stroke. And those strokes happen when blood or bleeding occurs either inside or outside of the brain itself. So again, stroke is just a true brain emergency.
Yeah, right. So is that obvious to a physician which one you have when you go in?
Not exactly. The symptoms can actually are very similar and are pretty much the same with stroke in general. And so we'll talk about some stroke signs and symptoms.
Yeah, let's do that right now because...
So what we use to recognize stroke and what we teach everybody is the acronym F.A.S.T, okay? Because one, we want you to be really fast when it comes to stroke.
Time is everything.
Time is everything. So the B stands for balance, or new onset balance changes, dizziness, okay?
Okay.
E is for eyesight changes. So blurred vision, double vision, tunnel vision, or loss of vision. This can happen in one eye or both. Okay, and then we move on to FAST. So the F is for that facial droop.
Right.
TV usually does a good job at this one. Most people know the facial droop.
Yes.
A is for that arm weakness, typically one side of the body or the other.
Weakness, not immobility, just weakness.
It could be immobility, or it could just look like weakness. It could even look like numbness or tingling at first. A lot of times a leg does go with that. Most time patients tell me that their arm just felt really, really heavy and they weren't able to grab things. Okay, and then the S is for speech changes. So you might notice slurred speech, garbled speech, trouble getting your words out. Okay, and then that brings us to the T, which is for time. It's time to call 911.
Well, and I want to talk to Whitney about that, because people who go, geez, just let's wait and see what happens, don't do that. Just if you have any doubts at all, call 911.
Right? Yes. We always want everybody to call 911. As soon as you call 911, your care starts. So when you're on the phone with a dispatcher, they go ahead, they may give you some information on what you can do before EMS arrives. And then when you're in the ambulance, they will pre-alert the hospital, so the stroke team will be ready for you upon your arrival.
That's a great point. Tell us about the stroke team and how they treat us when we get there and where we go.
So you'll come to the emergency department through the ambulance, and then there will be a team of people there waiting for you, of physicians and nurses and radiology, and we'll get you to our CT scanner and just start through that treatment process that we have.
Right. Well, let's talk about treatments a little bit, Sarah.
Yeah, so there's a couple ways that we treat stroke. So what's really important, again, time being of the essence, is we have within 4.5 hours of that symptom onset to do one treatment called TNK is what we use, or thrombolytic drug.
Okay. Yeah, we're taking a look at some video here.
Yes. This drug is also called a thrombolytic, okay? And so this is, most people call it a clot buster, all right? And that's what we want, right? If there's a clot in our brain, we want to break up that clot so that we can get blood flow back.
You said 4.5 hours. That seems like a very specific amount of time.
4.5 hours is all we have from last known well. That's what we call it in the healthcare world, is last known well time or symptom onset. This is just proven by research, and that's what we adhere to, right? And so we want patients to get there as soon as possible so that we can offer this drug. If they're outside of that window and have a very specific type of clot in their brain that's actually in one of the main highways of the brain, that's called a large vessel occlusion. We have one other treatment option available for those patients, and that's called mechanical thrombectomy. And that is actually where they go in and try really hard to just retrieve that clot and take it out. But again, that one, we only have 24 hours for that patient because after that point, there's too much damage.
boy, yes. Take action immediately,
Absolutely.
if at all. Let's talk about the resources that are available for folks out there who have suffered a stroke.
Yeah, so we have a hotline that you can call to help get in touch with a primary care provider. It's 1-888-BAPTIST, or you can call 501-202-2000. That's our operator, and then you can also go to our website at baptist-health.com.
Well, again, everybody wants to avoid having to go through all the things you just illustrated so wonderfully, but let's talk about preventing strokes real quick, if we can. What can we do? What lifestyle changes can we make to sort of prevent this from happening in the first place?
Yeah, actually, 80% of strokes are preventable. Can you believe that?
Wow.
That's a lot. And we in Arkansas live in what's called the stroke belt. Why? Because we love fried foods down here.
Of course, yeah.
Absolutely. I do too. I understand. But those things lead to high blood pressure, high cholesterol, obesity. Those are just a few of the risk factors that lead to stroke. So if we can control those risk factors by eating a healthy diet, getting some exercise every day, and then working with our doctors to control those risk factors, then we can actually lower our risk for stroke.
Whitney, is there an assessment that your doctor can do that says, boy, you're at high risk, you're at medium risk? Or...
There are some assessment pieces that they can use. Any additional risk factors, so each time you have one risk factor, high blood pressure, or diabetes, high cholesterol, any of those things.
All those add up.
All those start adding up.
Yeah.
So the more that you have, the higher your risk is.
Hey, listen, you all showed some really terrific resources on the screen as we went through this. Can we go to the Baptist Health website and find some of these things?
Definitely,
okay.
yes.
So mention the website for us, if you would.
It's baptist-health.com.
And just simply go there, and I suspect you can search for stroke and
Correct,
everything.
yes.
Ladies, thank you so much. It's so important to continue to share this information. You did a great job.
Yes,
Appreciate
Thank you.
Thank you. Thank you for having us.
All right.